Ray Tallis, a recent survey of GPs resulted in more than 40% of them supporting assisted dying, saying that they would assist somebody in dying. And yet the BMA Ethics Committee has changed its mind yet again and now opposes legislation on assisted dying. Other polls show as many as 80% of the general population support it. Now, it would appear that there's an unbridgeable gap between the medical profession and the public. Is that the case?
As things stand at the moment, there does appear to be a gap between the views of the medical profession and of society as a whole. A higher proportion of people in society as a whole, nearly 80%, support assisted dying, whereas the figure amongst the medical profession rarely reaches 50%. However, I am optimistic that this gap can be narrowed. I suspect that if many doctors went through the process that I went through of actually starting to understand the facts and also thinking about the things they're most afraid of, slippery slopes and so on, in a rational way, they too, I suspect, would be much more in favour of assisted dying, and the gap between the public view and the view of the profession would be narrowed.
Why can't we rely on palliative care to support people at the end of their lives?
Well, palliative care, of course, solves the problem for the vast majority of people who are dying. Most symptoms can be controlled, and it's very important that people don't have a sense of the inevitability of uncontrolled suffering at the end of life. But there will nonetheless be a small subgroup of people in whom palliative care doesn't solve their problems and comes nowhere near to solving their problems towards the end of their illness. And these are the people in whom it would be good to be able to offer the alternative of assisted dying.
Opponents of assisted dying say that it would just open the doors for dying on demand and would ruin irrevocably the trust between the patient and the doctor. Do you think that is a likely outcome?
The idea that legislation of the kind envisaged would erode the trust between doctors and patients is ill-founded. The evidence is that where there is such legislation, or indeed legislation for euthanasia, as in Holland or in Oregon, the trust between doctors and patients is very high. And this doesn't surprise me, because where there is such legislation, honest discussion between patient and doctor about all the options in end-of-life care is encouraged.
Are you of the view that doctors are bound by oaths that date back 2,000 years and that doing no harm means not hastening death?
And you are, of course, referring to the Hippocratic Oath. And I think it's very important to put that oath in its modern context. The first thing to be said is out of 27 UK clinical medical schools, 24 do not use the Hippocratic Oath. The second thing to appreciate is there are things in the Hippocratic Oath which we certainly do not agree with nowadays. For example, Hippocrates specifically forbids abortion. But I think the other point to appreciate is that he was an extremely wise and compassionate doctor. And I suspect if he'd seen how medicine had developed subsequently and had seen the needs of a small minority of patients who require assisted dying, he will be totally in support of it.
It is said that if the law was changed, it would only affect a very small number of people who were at the end of their lives terminally ill and wanting to die. And so the question has to be asked that, is it worth asking the politicians to consider this question at all?
I can understand those who argue that introducing legislation is, as it were, taking a sledgehammer to crack a nut. It would affect only a small number of people directly. Perhaps 600 people a year would require or avail themselves of assisted dying. But the benefits would affect a much greater number of people. First of all, there'll be those who would gain great comfort and relief from knowing that this was potentially available, that indeed if their symptoms were uncontrollable, there would be a way out. And then there would be a broader beneficial effect on all of us, it seems to me, who are undergoing the process of dying, knowing that there is going to be fully honest discussion about end-of-life decisions, and that whatever happens, the physician who is looking after me would not abandon me in my hour of greatest need. And I think it would benefit a much broader constituency than that small number of people who avail themselves of assisted dying.
I've also heard it said that suffering to the death is part of the human condition, something that has to be endured. People do believe this, and is it worth changing the law for?
The idea that suffering should be endured as an example, to me, is ethically totally unacceptable. First of all, I don't think you should sacrifice my well-being on the altar of your beliefs. And remember also, the notion that we have to suffer was used for centuries against making giving birth more comfortable or tolerable for women. And that kind of argument, it seems to me, holds back human well-being.
Again, if there was a change in the law, it said that the most vulnerable people be those who are at the end of their lives, but who think that perhaps by ending their lives prematurely, it will help their family, and perhaps they'll be the most at risk. Do you think that's likely to be the case?
I think the fear that legislation might put pressure on the most vulnerable people to feel that as they are a burden, in inverted commas, they ought to avail themselves of assisted dying, is a fear that I understand as a geriatrician. The whole of my professional career has been looking after older people, particularly the most vulnerable older people. So I totally understand that anxiety, but the fact is it doesn't actually stand up to empirical scrutiny. If you look at the experience in Oregon, whose legislation is the most similar, you will find actually the average age of people seeking assisted dying is younger than the age at which people typically die, and that they're usually people who have a track record of assertiveness, rather feisty people who are used to getting their own way. And as for pressure, the interesting thing is the pressure goes the other way. There's huge pressure from families to discourage people from availing themselves of assisted dying. So all those fears and concerns that I myself as a geriatrician shared prove not to be true in practice.
Based on your experience as a geriatrician, how do you think the older generation would respond to a change in the law like this? Do you think it would affect their relationship with their doctors and with their family? Will they not be put most at risk?
I can share with you my own impressions of the views of older people about assisted dying and how it might affect their relationship to trust with their doctors. And it is that on the whole, they seem very strongly in favour of having this as a therapeutic possibility if they needed it. And it wouldn't in any way undermine trust between patients and doctors. But that's just a personal impression. And as a clinician, I'm always very suspicious of personal impressions. So one needs to look at properly conducted surveys. And the evidence from that is quite striking. You'll find that the proportion of people who support assisted dying does not fall as they get older. Older people are just as strongly in favour of assisted dying as the younger population. And I think it's because, to them, it's something they feel strongly about because it's something they may wish to avail themselves of. As the relationship of trust between doctors and patients, the international experience shows that legislation supporting assisted dying does not in any way erode trust between patients and doctors.
If the law was to change, what provision would there be to protect doctors who didn't ethically and morally want to assist someone dying?
I think it is important to recognise that doctors do have different views about assisted dying. And for that reason, the Assisted Dying for Terminally Ill Bill makes provision for doctors who wish conscientiously to object to being involved or taking part in this.